Hello everyone, Dr. Jason Tomsic, and I wanted to discuss today something that a lot of our patients have questions about prior to surgery, and that is the use of surgical drains. Drains are used in multiple different surgical procedures, whether they're cosmetic or not. And the reason for a drain use is we're going to use a drain anywhere that we have a cavity that's created where fluid could fill up. So the most common surgery that we're going to use that for in the cosmetic world is the tummy tuck. And the drain is actually placed through the skin. It goes down underneath the flap and it helps to drain excess fluid out so that you don't get a fluid collection or a seroma. So what is a drain? This essentially is what the drain looks like. This is the area that's going to go inside the body cavity. And these come in various different thicknesses of size. This one is actually a very thin one. This would probably be used somewhere more like a facelift or even sometimes on breast surgery. The drain for a tummy tuck is going to be a little bit thicker than this. The principle is still the same. There's multiple holes in here in this part of it, and that's actually what's going to go inside. That's what the fluid is going to drain out through. On the outside of the body is going to be this bulb suction. The purpose of the bulb suction is to pull a constant suction so that that fluid comes out of the cavity. So what's going to happen is that this is going to be squeezed down, and then this little stopper is going to be put in the top of it. And so that is going to keep constant suction on there, and that's going to bring the fluid out of the body. Of course, as that fluid comes out, that drain is going to open up, and the bulb is going to expand. So these drains are very easy to take care of. Pull this out, the suction comes off, you empty it. There's measurements on here. We want patients to measure the output every 24 hours. Why is that? That's how we're going to know when to take the drain out. Once there is minimal to no output from this drain for 2 consecutive 24-hour periods, that's when the drain comes out. One of the questions that we get often is, what does it feel like when this drain comes out? Is there pain associated with it? And the vast majority of the time, there's absolutely no pain associated with pulling a drain. There may be a slight amount of discomfort. There's one suture at the skin level that comes out to make sure that this bulb is no longer on suction. It's just slid out from underneath the skin. Some patients say they get a sliding sensation, and that's pretty much it. So this is what a drain is, and the reason why we use it is to drain fluid from a body cavity that's created, or a cavity that's created during a surgical procedure.